Hello, I'm Michael Burgess. I'm a representative from the state of Texas to the United States House of Representatives. I represent the 26th district. I'm also a physician. Well, the question is, what about the fact that healthcare costs have come down in the past 2 or 3 years, and what is responsible for that? And Dr. Cutler out of Harvard had an interesting paper in Health Affairs recently about perhaps it was some of the changes that have been affected by the Affordable Care Act in the insurance market. Let me just first say that the Affordable Care Act has not made diddly squat difference in healthcare costs because none of the effects of the Affordable Care Act have really come into play at the present time. I've had a high deductible insurance policy really going back to 1996. My insurance has a $3,000 or $3,500 deductible. It certainly makes me very circumspect about any dollar that I spend because that first dollar coverage is mine. I'm basically paying the cost of that care. Now I have that coupled with a health savings account that ameliorates some of that, but I do think the presence or the feature of higher deductible policies that have certainly, because of their affordability, have made them much more popular in recent years. I don't think there's any question that that has affected the downward trajectory of healthcare costs. You can't back out the effects from the recession because honestly they were with us in 2008, 2009, but they are with us still, and certainly the number of people who have left the workforce, and we see that reported every month when the job numbers come out. If you don't have a job, you don't have employer-sponsored insurance, it's pretty obvious to say, and as a consequence, those individuals are either relying on a government program or they're paying completely out of pocket for all of their medical expenses. Again, those people who are paying out of pocket for medical expenses, and I know this from my personal experience, you do tend to be much more circumspect. One of the good news things, people are always willing to complain about healthcare in America and how other places in the world got it right and we got it wrong. One of the gifts that American medicine has made to the rest of the world is the whole concept of generic medicines. Yes, in this country there are some patent protections, trademark protections for brand name products. But generic medicines have really had a profound effect on the pricing of American medicine in recent years. We hear a lot about the so-called coverage gap. The popular term for it is the donut hole in Medicare. Bear in mind that a lot of the plans available in the Part D prescription drug benefit for seniors, a lot of those, you go online and you look at the drug plans that are available, and many of those plans have coverage in the gap if a person is willing to use a generic product rather than a branded product. The one thing that was left out of the Affordable Care Act that could have made a profound difference in the cost of health care in this country was the fact that any reform in the medical justice system, any type of medical liability reform, was actually left out of the discussion when the Affordable Care Act passed. And for me, that was an enormous sin of omission on the part of the White House and congressional Democrats who forced this thing through. We're going to ask our doctors and our nurses to be our partners in this brave new world of healthcare that's coming our way. We're going to ask them to accept a certain amount of risk, but at the same time, we're not willing to cut them any slack at all on the cost of their medical liability. I'd go so far as to say that perhaps there ought to be some type of federal liability insurance rather than federal health insurance. If we really wanted to make a difference in the cost of health care, that's obviously a realm that could be explored. But I don't think that Dr. Cutler is correct when he says that because we have bundled payments in Medicare, because we have accountable care organizations in Medicare, that these are the things that are bringing the cost of health care down. He then goes on to say that's good news because going forward there'll be even more of those. I would just offer the observation that none of those things are large enough, nor have they been given adequate time to show that, in fact, they're working to bring the cost of health care down. When we had the Medicare Payment Advisory Committee commissioners into our Energy and Commerce Committee to ask about this very issue, I asked Glenn Hackbarth, okay, why is it that healthcare costs have come down? And he said, no one knows the answer to that. I think that was an honest assessment, and right now, I think that's the state of knowledge.